I remember saying to my parents on the journey that I hadn't seen another area of healthcare with less information, less transparency about quality of care, less clarity for family members around what they can do to be supportive of recovery as opposed to protecting dysfunctional behaviors.
Welcome to the RANE Insights podcast. I'm Emily Donahue. News of the nation's opioid epidemic more or less took a back seat to news about the pandemic over the past 15 months. But the United States is still in the grip of a massive crisis that is stealing lives, costing billions in treatment, and crippling state systems designed to support those with addiction issues. And yet, other than lawsuits against Big Pharma, the many costs of this crisis have not yet prompted political will to overcome it. In this podcast, RANE founder David Lawrence speaks to Arden O'Connor, who leads the O'Connor Professional Group, to address the needs of families and individuals struggling with an array of behavioral health issues, including addiction. They discuss what can change, what will change, and what needs to change now.
Arden, I thought I would begin, because context is everything here, to begin to speak about sort of not only what you do, but why you do it, and your own personal narrative, which is, I think, particularly important and would be of great interest.
So I started O'Connor Professional Group 10 years ago. It'll be 10 years this July, which everybody says feels like it went by in a flash. It doesn't feel so to me. It feels like it's been a few decades running a small business. But I started it because my youngest brother struggled with addiction. And he has a pretty classic story of somebody who began using, we know from stats that if you begin drinking alcohol under the age of 18, he started around 12. Statistically, his chances of developing a problem later in life were 47%. I was sort of the other end of the spectrum, a nerd who waited till I was 21, and my chances went down to 9%. As I've shared with you, David, we're an Irish Catholic family, last name's O'Connor. So, addiction is sort of the name of the game in our larger family system. The running joke has been that the O'Connor Professional Group could stay in business just serving O'Connor family and friends for years. So my brother Chris had, unfortunately, sort of a perfect storm of genetic predisposition, ADHD in his prepubescent years, which we know is correlated with substance use, and a risk-taking personality. And he began his journey young with substances, alcohol and marijuana primarily, and progressed in his high school years to more high-risk behaviors around alcohol, eventually to cocaine and crack cocaine, unbeknownst to my parents. And still, because he was a very intelligent young man, he definitely had some consequences along the way. He got into a ski accident, actually because he was high on the mountain, and broke his neck. He was fine, but he couldn't play sports anymore. And then wound up, but he did manage to matriculate to college and made it through his first year with sort of mediocre grades. And in his second year, really began to experience some difficulties, to the point that we as a family came in and sort of hauled him out of his dorm room and realized shortly thereafter that he needed to get treatment. And he started, at 19 with the first of what became 15 different rehabs. And we have, one of the stories that you hear not so infrequently anymore of a family that was just desperate to get the right support. And he would go in and out of various detox centers, various residential programs, see therapists, psychiatrists, and everyone had a different opinion as to what was going on and why he was using and what he needed to do to get better. And my parents, throughout all of this, were spending, lots of time, energy, and money trying to figure out what to do, and all the while just terrified. And I remember saying to my parents on the journey that I hadn't seen another area of healthcare with less information, less transparency about quality of care, less clarity for family members around what they can do to be supportive of recovery as opposed to protecting dysfunctional behaviors. And that's really what motivated us to start O'Connor Professional Group. And we've developed from a mainly focused substance use business in Boston, which is where we started, now into a national organization that serves people with addiction, mental health, eating disorders, and autism. So a much broader array of behavioral health issues. But that was sort of the journey I took, and feel very fortunate to run a company that I truly enjoy working at every day.
And I know just from your background and you know, we spoke about you're going on to Harvard Business School and recognizing what was missing in the marketplace here. And you talk about the fragmented nature of information. I want to maybe put this into a little more plain speak, Arden, which is for so many years and for so many generations, people have not known where to turn to get the information they need, get the resources that they need, get the help they need, and I'll also add to get the understanding and empathy that's needed. And for far too long, stigma and shame have ruled, and also ignorance. And as we're coming out of this particular pandemic, I'll editorialize a little bit. I just feel that something has really been lost in the national dialogue of what families go through, what people go through, and I'll call it a failure writ large of the system to help people gain the information, the insight, the evidence-based resources that are needed. And I know that's basically become your life mission.
It absolutely has. I think for a whole host of reasons. I mean, I think we know, and I'm sure you're more well aware of this than many, David, but we know that there's been a ton of institutional capital moved into the residential, treatment business. And I actually think it can be a good thing in many ways. It can professionalize prior mom and pop shops. It can help people figure out how to implement outcomes better. But at the same time, a lot of money has been poured into search engine advertising and figuring out ways to attract patients, which again isn't a bad thing. But I think what we have learned is it makes families enormously confused. So if you go to just Google addiction help for my son, you're going to get thousands of different, websites that pop up, many of which look very similar. And so because we're in this business and we work in it every day, we have a sense of this program versus that, or this provider versus that one. But it's very hard as a layperson to distill the information into a digestible format, particularly when you're in a crisis. Usually it's, in a lot of cases, better than 50%, the person struggling with whether it's the mental health issue, the substance use issue, the eating disorder, even autism, the person themselves isn't necessarily raising their hand with insight into what's going on, saying, I know I need help. Sometimes, if you're lucky, that's happening. But many times it's a parent, a spouse, a child of an adult parent, another type of family member who's saying, boy, I think there's something wrong here. We need to get this person the care they need. So I feel like it's an unrealistic expectation. There's no go-to resource. And I think the one we've seen people go to is a physician, which if I want to say the number is that physicians get a total of 1 hour of teaching in all of their education around substance use and addiction, which is to me mind-boggling given the position they're in from a prescribing standpoint. But nevertheless, it's part of the reason that for my family and for many that we serve, having access to information in a moment of real emotional turmoil where you can be clear and you can help people find a path was an important mission for our group.
And as you know because we have known each other for now a good 5+ years, 6 years, when I started RANE and brought in Dr. Lesser to head the Medical and Psychological Network, it was with an acute understanding that even the most sophisticated and educated individuals didn't know where to go, where to turn, what to do in these situations when they had an issue with a loved one, whether it was a spouse, a son, daughter, brother, sister, etc. And I saw this play out time and again, not only at Goldman Sachs, but at the U.S. Attorney's Office, where we had one of the most talented prosecutors who was dealing with some mental health challenges, which we didn't know about at the time, but became heavily addicted to cocaine, and his career and his life spiraled out of control. I want to ask you what I have found, and I'll ask you to correct me if I'm wrong. we know some of the things that we have to do. We know how to identify signs. We know the types of treatment intervention that has a higher probability of working. We know this is a chronic disease and one that needs where people need constant support. We know it's a disease of the brain, and we also know that it often lives, I'll use the word coterminously, with other mental health challenges. And yet, Arden, I can't help but just sort of look out and wonder whether, we've made progress. Yes, as you say, with the internet and Google, we still don't seem, with a couple of exceptions, and the government has, one or two websites, people still don't know sort of what they need to know, and they don't know necessarily the best resources to turn to, and what they need to know in the moment and what they need to know down the road. And I'm going to ask a very simple question, but why is that?
It's a simple question, as are many questions, with a complex answer. I think the simple answer is that much of the research that has been done in addiction hasn't been applied in practice. There are plenty of evidence-based practices that we know that are available, but available to whom, with what insurance, in real time, with somebody who's resisting care, and under what circumstances, is sort of the puzzle that I think makes it much more difficult and very distinctive from the medical system. At the time, years ago, when my brother was in the midst of his addiction, I wound up with leukemia, and I am fortunate to have, actually, my brother with the addictive disorder was my bone marrow donor. But I always say to my parents, at that time, they could very clearly lay out, if you go the path of repeated rounds of chemo, here's your chances of survival, here are some of the risks of mortality, here's what you'd feel in terms of symptoms. If you go the bone marrow transplant, here's same information, here's what's covered by insurance, which is 100%, 99.5% of the cost. On the behavioral health side, if you looked at my brother's addiction as another example, because of all these complicating factors, patient resistance, question of whether there's a co-occurring diagnosis, the therapeutic alliance, a lot of the words you'll see on treatment centers is information about evidence-based treatments. And don't get me wrong, I'm a big believer in looking at data and figuring out what works. And at the same time, we also know that you can be using the best techniques and not implement those techniques the way they were originally designed in the study. Or you can be a therapist who has no ability to build what we call a therapeutic alliance, and your outcomes are not going to be as good regardless of what modality you treat. So I also will say, I think historically, behavioral health issues of, my colleague likes to call it, of issues above the neck, were sort of treated like a sidebar or they were not integrated into the medical system the same way we look at heart disease and major other diagnoses. And some of that's stigma, some of that is funding, some of that is perception about, you mentioned earlier, which I think is important to just reiterate, it's a chronic disease. I don't think that mindset for the lay person was accepted maybe until the last few years. And I will still say there's many clients we work with who say, nah, he doesn't have an issue. He's just got to, pull himself up by his bootstraps and get to work. And I'm not worried about this anxiety, quote unquote, thing. So I think there's a whole host of reasons as to why we don't have the same advocacy, the same availability of information. And I do think stigma, while I think one benefit of COVID has been that it's brought the conversation about mental health and substance use, I think, into the mainstream media outlets, into Wall Street Journal and mainstream publications. I do think I think we're starting to see people more willing to admit these issues, but I think there's still, we always joke, but it is actually a truth. You get cancer and somebody brings you a lasagna. Your son goes to rehab. You're probably not going to tell anybody, and nobody is bringing you lasagna to say, I'm so sorry. It's going to be more of something that's hidden away.
And so you're getting to a point that I keep trying to understand, because I still remember in the 2016 election, I think every one of the candidates had a loved one or close friend that either had been lost to addiction or was in the process of struggling with recovery. And even that didn't seem to generate, other than a bit of lip service, much political traction. And I remember Senator Klobuchar actually was one of the few candidates, in the recent run-up to, the nomination, who actually had a policy on her website about dealing with this. She saw it as a priority. And I've been trying to understand, as many of my friends and colleagues, and I will tell you, fortunately, I acquired enough insight to be a little bit dangerous that I was able to help people at Goldman Sachs whose loved ones, they didn't realize what they were struggling with, but we were able to get to the bottom of this. But I'm having trouble understanding sort of the slowness of this, because the number of deaths, the number of people that have been lost, certainly rivals, if not dwarfs, what we've just gone through with the pandemic. The number of loved ones that have been lost into the streets, into the prisons, and just disappeared. The economic costs, we've had members of the Federal Reserve who have testified to the economic costs of substance dependency and its toll on the economy. No less, I've done some traveling and been through some towns and cities you can just see have been decimated by this. And yet, I'm just not seeing, this becoming a priority, and I'm really having trouble understanding why. And, I've had these discussions where people have likened it to the AIDS crisis, where people said, well, this is God's will. People are being punished for their own activities, or they should control their own activities, etc. And yet, this got off the ground, and we now look at AIDS, and we look at consensual sexual activity in a very, very different way. We know people take risks, particularly when they're young. We know that social pressures, often determine the use of drugs recreationally or otherwise, and alcohol. We know people who are suffering with anxiety and depression often revert to self-treatment, and they feel better for a while. And we understand how quickly people can become dependent, and not the least of which, Arden, because I know, but we're going through a time where it is now very, very clear certain corporations marketing opioids in a way that was truly unsafe. Doctors, whether knowingly or unknowingly or unwittingly or willfully blind, were prescribing at levels that were unsafe, that the most innocent individuals got hooked and their lives spiraled out of control and often into death. And families were left with the cost of this. I mean, I'm just not feeling political, I'll call it will, to make this a priority, notwithstanding costs in lives, to families emotionally, to communities, to the economy. And I'll argue it's an issue of national security, because what experts are telling me is there's a whole nother wave of addiction coming behind this. I'd love to get your view on that. And inversely, what it would take to finally get people to recognize that this is such a priority.
I wish I had a fantastic answer. I mean, my gut comes back to, something I think you alluded to a little bit. I think for many people, if you've not, while I think that the vision or the image of somebody with an addiction issue is starting to shift, I still think there's a good portion of our country, if you haven't been impacted personally, that believes this is somehow separate from me. I used to joke with my brother that people with opiate dependence weren't, cuddly little teddy bears. They don't have, and families, I think in general, and individuals oftentimes are trying to shield themselves from pain. And, the natural thing for anyone who's seen a tragedy is to say, well, thank God I wasn't, but I don't take that bus route, or I wouldn't put myself in that situation. And it's not, I think, a lack of compassion. It's how am I different from that person, and how can I protect myself from that happening to me? And I do think there's a bit of that with addiction. I think it's a group of individuals who cause, as you sort of said in the beginning, there's productivity losses at jobs, there's healthcare costs, there's incarceration costs. It's a population of people that hasn't had an advocacy group behind them in the same way that even the AIDS crisis did. And I think without that, I don't know actually what it would take for politicians to pay attention. It's not, I think there is a divided view in our country, no matter what physicians say, no matter what medications come onto the market, no matter how much we talk about the opioid epidemic being just that, an epidemic, and addiction being a disease. I still don't think it's as popular of a stance to take that, we're going to treat this. I still think there's a lot of fear about people with addiction issues selling drugs to kids or coming into your neighborhood. And, and I think even, I've been impressed. There's been a few groups, a few nonprofits in our country that have done real work to try and get better access to care, better transparency around what providers are offering. And there's an organization in Boston that does some very controversial work, things like sending fentanyl testers. I'm of course going to say this all incorrectly, but a way to actually measure if you have people who are homeless on the streets using heroin, to test whether or not what they're ingesting is what they think they're ingesting, because accidental overdose is a huge issue. But that work, again, and I've been shocked. It's a group called Rise Massachusetts. I've been shocked by their work because I think it's so progressive, and it has some very well-known business leaders behind it. But that is new. I would say that's, the last 5 to 10 years that people are willing to take a stand and say, this is important work and we're going to go after it. I think in general, it's just a cause that that is harder for politicians to get behind, for sure, because the people who represent addiction and recovery, even to some degree, are not the people that necessarily inspire the rest of the country to get really excited. It inspires people like me because I was related to one who passed away from an overdose, and I'm related to 2 other people in my family, in my immediate family, who have, who are in long-term recovery. So, but it's not necessarily an issue that if you haven't had it in your family system, people understand or really get excited to get behind.
Right. And I don't want to dwell too much on this because, and I like the fact that your point about an advocacy group. And I've sometimes, in my mind, I've envisioned if all the mothers came together who have, and they're out there on Facebook. I've read so many of the postings, and I've read the obituaries that, have been written as people, they kind of came out of the closet to acknowledge, what happened to their son or their daughter. And you certainly have heard from them in the context of some of the litigation going on. When we had every single presidential candidate in 2016, Donald Trump, who lost his brother to alcohol, Chris Christie, spoke eloquently, and Jeb Bush was dealing with this. The Clinton family has had friends and such, and still nothing emerged. And I'm still trying to ponder as what it's going to take.
I wish I had a great answer for you. I think I'd be running a much bigger organization, or probably be in a much better position if. I do think so. I'll say a couple things. I say, I don't have an answer. I certainly don't have the vision that someone in the government would need to create, landmark change. I do think it's not going to be any one thing, which is an obvious statement. I think, we see people who get very dogmatic about it's medication-assisted treatment, it's AA, it's therapy, it's this, it's residential. And, what we've seen in the course of running our company is that different people respond to different modalities, different types of interventions, different levels of care at different points in time. And there's a lot of human factors that go into what makes sense for what person at what moment. If somebody's got two small kids and staying home to be a presence for them makes more sense than, outpatient treatment plus medication may be the best way to go. If someone's in an environment that is filled with people who are high risk, and they don't have a job and they're not functioning all that well, then residential may be a better answer. And there's all sorts of family dynamics that go into the process. So I do think it's figuring out how do we have care that's accessible to all, particularly people on public insurance, Medicaid, Medicare, because we still are woefully underrepresented in those categories. I think it's figuring out how do we address this as a chronic disease instead of people assuming that if someone goes to a detox or to a residential program for 30 days, it's sort of they're fixed and they're going to come home and return to life and as normal. And how do we as family systems, as educators, as employers figure out what's a reasonable transition and what services are going to need to be in place in the community? I think that's, a big piece of the puzzle, because I do think aftercare is an area where most people struggle. They get back into the temptations of their daily life and into the stressors, and it's very hard to maintain sobriety. I think families being more open to getting support for themselves. What we like to say, everyone asks us, do you just work with the individual patient? And what we have learned again in the last 10 years is that many times the individual person with the diagnosis they're not interested in getting help, or they're not interested in the help we're offering. But the family can do a lot of different things that maximizes the chances that that person gets better and can reduce the chances that that person winds up in a worse position. They can't control the actions. I'm not suggesting that. I'm not going against the ethos of Al-Anon, but I do think family members understanding the disease, understanding what protecting behavior looks like. We don't like to use the term enabling, but how do you avoid allowing someone's dysfunction to continue? So that, I think, access to services for families. I think one of the most impressive things I've also seen in the nonprofit field is drugfree.org offering free parent coaching to parents, because I think that's such a hard area for many people to get the help they need. So I do, and I think the last piece, and I sort of mentioned this earlier, but having better early detection, and I come at it from a physician standpoint. I think, I am thrilled to say that in the last few years, my doctor asked me now, how many drinks do you have per week? Have you ever felt like you were going to hurt yourself? Have you been anxious and depressed? Those questions were not on my screening appointments 5 years ago, 10 years ago. But I think more education of people that families are going to go to in communities. And, if you think about average families, they're going to go to the clergy, they're going to go to their physician, probably first and foremost, and they're going to look for solutions. And so I think the more that we can get doctors and that sort of, not really a first responder, but that first responder type to be ready to make not only, triage if there's an emergency, but really make some important referrals and integrate the care into the mainstream health of that person. So every visit you're checking back in. I know you were struggling with drinking a little too much, or I know you were struggling with feeling sad and depression. Are you seeing that therapist? Making that a regular part of the checkup, I think, ensures that there's at least some more preventative care, which is what we don't have in this country either. We wait until somebody is, metaphorically or literally bleeding, and then we treat it. And that's a much harder proposition because somebody's behaviors are much more ingrained.
So you've made a number of good points, and great points, I should say. What you're highlighting is that in understanding the mental health challenges and the issues of dependency, first of all, it's not one size fits all. There are many factors that lead into the conditions, and there are many potential responses that have to be tried before you actually start to see some that work. When you're counseling, because I want to give people hope here, I am frustrated politically with how this nation has, failed to prioritize this, and people are still lost in the streets. If you want to speak about, the incarceration issue, also share with them, a sense of optimism of what we now know today can be of extraordinary help to the individuals and to the family or loved members who are supporting them.
It's a big question. So I think, a few things. We know that roughly 10% of the population is considered to have a substance abuse issue, and that includes addiction as well. And that number is estimated to be underreported because most people who have an addictive disorder wouldn't necessarily identify as having it. We know, I think from a statistical standpoint, I would say the biggest newer news is around COVID. So we know that about 20% of the population has a mental health issue. If you look at stats prior to the pandemic, I would say about a third of the population reported experiencing anxiety. Post COVID-19, it's closer to 50, mid 50, 53%, 55% of people are reporting feeling anxious. So we know, I think it's interesting because a lot of the conversation in media has turned around, the impact of COVID, which, don't get me wrong, it's exacerbated issues, but it exacerbated a tidal wave that was already coming, and that employers knew they were coming because they've been looking at our health care claims data and watching where the major costs are. And if you are a small employer or a large one and you have multiple employees with behavioral health issues, and even one of them has to go into some type of residential program, what costs that incur. So we know we were already living in a society that I think was, because of many factors, was dealing with the opioid crisis, with rising rates of anxiety and self-harm among young people. Our rates of suicide have grown dramatically for ages 10 to 14 since 2017, which is a very scary group to think of, having increasing self-harming behaviors and suicidal thoughts and actual, suicide attempts. We also know on the genetic side that if you are the son of an alcoholic father, which was the case in my family, you are 4 to 6 times more likely to be an alcoholic yourself. So there are, the good news to your point is, and there are, and I'm by no means an expert on this, so I hope you don't grill me, but there are increasing amounts of data that are available for people to look at. Everything from, how do you personalize your medication regime to fit your genetic makeup? We know that there's more and more devices that are wearable in the home that allow people to exist with a mental health issue or with a substance use issue, but still live their life fully and not feel like they need to be institutionalized. We know that there are medications. I think one issue that I am so passionate about, and not because I'm a physician, but more because I run a case management company, we know that compliance around medication regimes is a huge issue for somebody with a substance use disorder or a mental health issue. And there's an increasing number of injectable options on the marketplace. So you probably know more than I do in the digital health space, David, of, how much invention is happening there, and everything from, mobile breathalyzer testing devices to companies with various types of apps where you can get on-demand coaching or on-demand therapy. So it is a field, again, that's getting a lot of institutional money put into it. There's a lot more focus on innovation, and I think there's a lot more recognition of that, while we will always have a continuum of care that includes traditional outpatient therapy and hospitals and bricks and mortar, I think the world has expanded in terms of what options are going to look like over the next 10 to 15 years for people struggling with behavioral health issues. So I think those are some of the reasons I'm optimistic. I also remain optimistic because you see an increasing number of people owning stories in the public spotlight. It used to be, and if you looked at 15 years ago, somebody would catch Britney Spears or whoever the celebrity of the moment was leaving rehab. And it would literally be a paparazzi, quote unquote, catching the person. Now you see public figures, celebrities, singers, and as much as, there's controversy about whether that's always the best thing, I actually like to see people that the public knows coming out and saying, I had this issue, this is how I'm thinking about it, and sharing their story of recovery. I do also think, one other sort of more random reason for optimism from my perspective is I think we're seeing a generation of people who are looking at health in a different way, whether it's for environmental reasons. I have a very progressive physician who is all about the plant-based diet. And, if you told me as an avid steak eater that I would be approaching 2 days a week of vegetarian eating and sometimes even more, 5 years ago, I would have laughed. But that is sort of the mode I'm going in. And I'm probably 5 to 10 years older than the generation who I think is really hyper-focused on this. And the reason I say that gives me some hope is because I think about things like alcohol use, which is, in my opinion, one of the more insidious issues, because it's, most people, if you say you have a cocaine or a heroin problem, will say you need to go get help. Alcohol is sort of blessed as one of these things that we can celebrate with, we can drown our sorrows in, and a lot of high functioning people use it and use it too much. So I think this next generation that is focused on health and wellness and embracing meditation and mindfulness, I do hope that it is going to be a generation not only that's not engaging in the Mad Men, 2 Manhattans at lunch and then a couple at the end of the day, which we know now statistically is way above what you should be drinking in any one day, but is also just a group of people that, whether they develop an issue or not, is going to look at alcohol and drugs and other substances and anxiety and stress as part of a holistic picture of health and try to do their best to mitigate their exposure to risks in our communities.
Thank you. We're going to post, a number of your materials up on our website, and I very much look forward to the continued conversation. I thank you for your public service, for your thoughtfulness, for your empathy. In essence, it's about, how to scale the great work that you and others have been doing here, because this is a treatable and solvable issue, but not if we continue on the current path. And thank you for being part of the RANE network.
Wonderful. Thanks so much. This was fantastic. I really enjoyed it.
Arden O'Connor leads the O'Connor Professional Group to address the needs of families and individuals struggling with an array of behavioral health issues, including addiction. You can learn more about the group at ranenetwork.com. Individuals and organizations turn to RANE for risk intelligence that cuts through the hype to focus on what they need to know, what to expect, and what to do. Take advantage of our network's expertise. Subscribe to RANE's core membership today and let us power your business to success. Learn more at ranenetwork.com. That's RANE network.com. I'm Emily Donahue. Thanks for listening.